I'm Dr. Kevin Chen, a medical oncologist at MedStar Health. From diagnosis through treatment and into survivorship, we're committed to offering the highest quality, evidence-based care to every cancer patient we see. I treat many types of cancers, but the most common type of cancers I treat start from the GI tract, so the esophagus, stomach, pancreas, colon, and rectal. But I also treat many types of lung cancers as well. Treating cancers is very complex. It involves many different types of doctors, many types of treatments, and so every single patient is treated differently. A lot of it is dependent on the type of cancer, the stage of cancer, and also the condition of the patient, what other medical problems they have. So anytime a patient comes in, we have to go through everything about the patient to come up with the best plan of attack. Immunotherapy has been a major advance in the treatment of all cancers. It is less toxic than chemotherapy in many respects. It is more effective than chemotherapy in many respects. And oftentimes it can be used with chemotherapy to enhance its effects. That being said, chemotherapy is still very important for many patients. It is effective in killing cancer, and when used in conjunction with immunotherapy, it can enhance its effects even more. Clinical trials are extremely important in the oncology world. It is how we make advances to improve every patient's outcome. In my career, I've seen many cases where clinical trials have had an amazing impact on my patients. For example, I had one patient who was on a clinical trial for a new immunotherapy drug that wasn't yet FDA approved. Because she had early access to this drug, she is now 3 years out still in remission, where she might not have been otherwise. There are many cancer treatment programs across Baltimore, but I think MedStar Oncology is one of the best. We are all at the top of our field. We use the most cutting-edge technology, and we use the most up-to-date treatments. We offer everything a patient needs, all the best physicians, clinical trials, technology, and yet we're also convenient. We're right here in the community. Patients have to come every day for radiation, every week for labs and chemotherapy, and being able to do that right in your backyard makes a huge difference. Cancer treatment can be very complex, and we really have to take the time to walk our patients through it step by step. And so I'm always available by phone or in person to field any question a patient or their caregiver may have. I chose oncology mainly because of the patient interactions. I'm inspired every day watching my patients struggle through some of the most difficult things they'll ever go through, yet coming through on the other side stronger than they ever thought imaginable.